What is concierge medicine? What does that even mean? Right now in America, we have a healthcare crisis. And a lot of times doctors really don't have enough time to sit with patients. And when they don't have enough time, they're not able to figure out what's going on with them, understand their pains, their frustrations, and you see an increase of patients going to the ER because they're not able to see their PCP. And so what's happening right now? I had no idea what concierge medicine was. And recently, a good friend of mine, Dr. Humera Ahmed, was working at a different company and decided to open up her own concierge medicine practice. And she educated me on what concierge medicine is. Concierge medicine is not for the really, really rich and famous.
To be present in the moment.
It's Fashion Week, a really fun.
It's not that expensive, actually. You actually save money having a concierge doctor because you actually save money on the back end with your healthcare expenses. And I did not even know that.
Anything's possible. Anything's possible!
So in this Care Pods, we're going to sit down and break down specifically what does it mean to be a concierge doctor for those who are in the mainstream type of healthcare and working with corporations and they're thinking about branching off. She's going to break that down. If you're a patient and you're just getting frustrated, not meeting your doctors, and you call your doctor and say, hey, I need to see you, and they say, okay, see you in the next 4 months. That's frustrating. What do you do? Dr. Humera Ahmed's going to break that down and educate us on what does it look like for her and her patients and how she's able to pick up the phone and text them and call them and get to know them and really bring the heart of healthcare and PCP and your doctor back to where it is and where it should be. So hope you guys enjoy this with Dr. Humera Ahmed.
See the future of concierge medicine going. Is there anything that you'd want to critique, improve?
I think the concierge medicine is nothing new. It's been there for many years. It's growing and people knowing about concierge medicine more than before. So I'm pretty sure like in few years, everybody will go for the concierge medicine.
That's good. That's a lot. That's like
it's been like, I was reading about it, it's been there for 10, 15 years.
Really?
I swear. Even
Wow.
I didn't know until few years when we started researching about the concierge.
Wow.
So it's really growing.
Wow.
And I know that in few years, every primary care physician will adapt a concierge because that's the best way to practice.
Yeah. That's because you were able to talk to them directly. They know you, that you have that relationship.
You have so much time to spend. You understand them so well. You feel connected. And that's the best way to develop a patient-doctor relationship. I think open communication. Listen to them.
Wow.
And if you hear them and you understand them, they really build a strong relationship with you.
And you can better serve them because you know them so well.
Absolutely.
Yeah.
You
Wow.
feel that for them. You feel for them. You feel so connected with them.
Wow. That's cool. That's cool. What else I got?
I know this one's a little basic, but what got you into medicine?
Oh my God, I was just in grade 3 when I had a passion for becoming a doctor.
Wow.
And it was my passion. I was seeing a lot of sick patients. I was from Pakistan, so I was seeing so many sick patients. Sick people, poor people, and it just like came in my heart that I want to be a doctor. So I was just in grade 3.
Wow. And you remember it vividly.
Oh my God, I was working day and night to be a doctor.
Wow.
Whatever I am is because of my parents. So they really helped me, they really supported me. So it was basically a passion, it's still my passion. I can never leave working as a physician. So same goes for my partner, Dina Deal. I mean, we both have strong passion for patient care.
Yeah.
We love it.
That's cool. Wow. Where'd y'all meet? Just curious.
So my partner, Dina Deal, joined as a hospitalist when I was already working as a hospitalist, when we were only 2 female as a hospitalist in Texas Health. Wow. So we get connected. I mean, we were like 2 female, have the same issues, same thing.
Yeah.
And after this, after 5 years of hospitalist, we decided to little bit slow down with the schedule because we were mothers as well. So we want to spend more time with our kids. So we went to the traditional. And Texas Health Hospital really supported us. They opened the internal medicine practice there. So we were working as a traditional primary care physician for 10 years.
Wow.
And then we loved it. I enjoyed being a traditional primary care physician. I think traditional primary care physician made me a fine doctor. I will never forget how they helped me.
Right.
But then 2 years ago, I decided, Dr. Deal and I decided to open a concierge practice.
Wow. When you were deciding to do that, was it kind of was it nervous? Were you nervous a little bit to kind of transition from holistic, like everyone's doing that type of medicine, to now a different type? What was your thought process?
So we loved working as a traditional primary care physician, but with years, we are noticing some limitation, which were not going well with the patient's care, and we were seeing more patient frustration. We do not want to quit as a physician. So my partner, Dr. Deal, came up with the idea, why not concierge, which is more personalized care? And we loved the idea. Of course, it was a new business for us, so it was very scary. Some people were encouraging, some people were not encouraging. But I think as two female physicians, we were very strong. We said, we can do it. We can do it, and we did it.
Wow.
So we have been partnered for 15 years, and just in short, we cannot live without each other.
You guys two peas in a pod.
Yes, we work very well.
That's cool.
Same work ethic. We have a same passion for patient care. So we work very good together.
So when it comes to, if someone was to look at, okay, going to a PCP that's not a concierge and then going to a PCP that is a concierge doctor, what are the main differences that you see between the two that would help put a patient at ease when they're deciding to go to either one?
So I did traditional, and I'm doing concierge. I know what is traditional primary care physician. Both focus is patient care. The concept is who's providing the best care. And I feel like as a concierge primary care physician, I have more time with my patient. There's no rushing through the appointment. We do not have large number of patients. We have a very small panel. And the reason why keeping the small panel is to provide quality of time with the patient. So the patient does not feel rushed. Their concern will be heard on timely manner. We provide our personal number so they can easily access you. So the access to primary care physician is very easily available as compared to traditional primary care physician. Plus, we are available for acute visit. When patient are acutely sick, we are there to take care of it on timely manner. So I have notice that because we are available all the time, the admission to the ER in the hospital is so much reduced as compared to my traditional practice. Plus, you know, we are not only focusing on medical problems, we are focusing on preventive, we are focusing on wellness, which is very important for our healthcare. And we are making a clinical decision for our patient not directed by the insurance company. So we have a freedom to make clinical decision for our patient, which is good for our patients.
And you're able to really tailor the care towards them.
Absolutely. I mean, we are not directed by the insurances.
Wow, that's
so
true.
The care is excellent. If you want your health as a number one priority, then concierge medicine is way to go.
Wow. So if say for instance, you become my doctor. Let's just say I need help, right? So, and I call you and I say, okay, let's start, you becoming my doctor. What does that look like? What's that process from the start? How many times do I get to see you? Like, what is that process?
So if there is a new patient who doesn't know me, because few of my patients, they followed me from my prior practice, so they know me. So there are patients who doesn't know me, so we offer them complimentary meeting just to know us, like how our personality is, how we communicate. So they come and they have a meeting, which is completely complimentary. And if they feel like, okay, this is a good practice, they sign up. When they sign up, we tell them the first visit, whatever they want to do, like a first visit just to establish a care. In that first visit, we spend good 60 to 90 minutes.
Wow.
Good 60, 90 minutes, we discuss their concern. We listen what are the main concern in their health. and then and what their expectations are, how they want to be treated, how aggressive they want to go, what are the things they want us to address, how they want us to approach. This is very important because in the end, that's their body.
Right.
They have a right to make the decision.
Right.
And then after this, we make the plan together. And we make the plan together. I always, and in fact, my partner, we always ask, we recommend things, but if they don't like it, then we need to figure out what are the things that they feel like they don't want to go and follow this recommend. And it's okay if they don't want to do it, because in the end they will come. They will go to the right path.
Right.
And it's only because of enough time. And enough time is about educating and counseling.
Right. Right.
It's very, very important. If you educate them, if you counsel them, if you explain them why you're ordering in, why do you need them, they do listen to you.
Wow. And that's beautiful, because you're looking at 60 to 90 minutes of a very thorough assessment.
Very thorough assessment in which we go through each and everything. We talk about preventive, we talk about wellness. We also incorporate holistic approach, and as you know, the holistic approach is getting more and more common and more, and the reason is getting more better because it does not only target your root cause of your problem, but it also addresses your different aspect of life. Nutrition, your hormone, your stress, your sleep, everything.
Wow.
And it's very important for when we are dealing with health.
Wow. So how does it work with like labs, or like if you need labs or things that are drawn, do you guys still use insurance? Does concierge medicine use insurance sometimes, or how does that work?
So everyone is different. So our practice, what we have decided, we do have annual membership, which is just to cover the concierge services, and the cost come from the patient's pocket. But we put it in such a way, we offer installment plan, so it's easy for the patient to pay, and it's once a year, so you can do it either 3 months, 6 months, or annual.
Cool.
But we also take medical insurances, so all the medical visit, lab, diagnostic imaging go through your medical insurance, so that there will be less burden. You can do as much as visit as you want. If you cannot come to the clinic because you're sick, we can do televisit. We can talk on the phone, and even on the weekend. I mean, if you need a physician, we'll be available, and you'll be talking to your own physician. You're not gonna talking to different physicians. In any ways, we are only two, but we cover our own patients. So it's nothing, oh my God, on the weekend what we're gonna do. We are available 24/7, and that's the best thing for healthcare.
It's true.
Even I have a patient who travels and they call me outside the state, and we help them. They don't have to go anywhere. They just call us and we take care of them.
And it's interesting because we were talking about this before, is that a lot of times patients are just fearful, right? And so by having someone that they could just pick up and call, that mitigates that fear, lowers those anxiety, that all those things to make, because sometimes when you are anxious, you make bad decisions, right?
Absolutely. And Charles, the compliance is more with the concierge. I have a patient who's scared of doing testing because they are scared. When you speak to them, when you talk to them, maybe they will not agree on the first visit. Second, third, they text me on their own. They said, okay, we are ready. And we make sure that they get an appointment they should see. So we text them, hey, did you make an appointment? It's okay, we are there. So they do. I'm telling you, there are a lot of people who get scared of screening tests, but when you speak to them, when you remind them, in a way, they don't think that we are doing it just to get the numbers. No, we are doing it because it's your benefit.
Yeah, and I think another thing we were talking about is that with less volume, there's more time. Right.
A lot of time.
And so a lot of times with, unfortunately, insurance, and it's all about how the payer mixes and the units and billing, right, and coding, you're now able to just focus on the patient.
On the patient, we have less paperwork, more patient care. Patient, they don't feel rushed, and they can discuss any symptoms. I mean, it's nothing. Oh, you're here for physical, just discuss your physical. No, they can discuss anything. Anything they want to discuss, because that's their time. So it's a great way. I've never knew that by doing the concierge medicine, I'm doing the great thing by providing the patient care.
Wow. Another thing we were talking about too is that, you know, sometimes I think patients and families don't realize that most of their expenses are actually medications.
Medication, right? Polypharmacy. So we have time to narrow down. I have so many patients that we have narrowed down the medications. Why? Because we have time. I have elderly patients come who does not even know what they are taking. So we remind them, okay, you have to bring your medication list. You have to take a picture. You can only do it if you have a time. And the best thing is our clinic is successful not just because of physician, because of the staff. The staff is very well trained. And besides our clinic, I would say home health specialists, they all part of our success. And the reason is we are communicating with them. We are communicating with them. I've never had so much chance to talk to the home health staff. When I was in traditional practice, it's usually covered by my medical assistant. But now they talk to me.
That's cool.
And it's such a nice way to take care of the symptom right away.
And to coordinate effectively.
Coordinating. And the specialists, I'm very thankful to our specialists who's very supportive, who take care of our patient in a timely manner. They really take care of our patient, and they're very happy with our specialists.
And that's good because, if you don't mind, can you talk about how concierge practices also coordinate with other specialists? Kind of walk us through that.
So how we do it, we have a very good relationship with the specialist that we have been working for 10 to 15 years. So if the patient do not have preference, then I would like to send to the patients who I trust. So that's number one. So I know that they will take care of my patients. So when the patients go to the specialist, yes, 80% you get the visit note back. Then we reviewed, we want to make sure whatever the plan they are doing, that plan coincide with my plan. There's no medication changes. If there's a medication changes, I make sure that I speak to the patient and they are aware that this is what they have changed. The second, we really trained our patients. When you go to the specialist, text us and tell us that you did. So that I can get the visit note. If something the patient do not understand what the specialist mean, or they need to see the specialist little acutely, we just call them and tell them that, hey, can we talk to the specialist? Most of the time specialists really respectful. They come on the phone, they discuss, they said we'll take care of them, and they do. And so there's such a good continuity of care. And now the specialist text us, hey, listen, we saw your patient, this is what we did, can you keep an eye?
And that's so crazy because I feel like that probably would have not happened as much, especially not being, because like you didn't have the time.
Because a lot of patients, they are busy. So one of the specialists texted me that I really want these labs to be done, can you take care of it? Okay, now it's my duty. So I'm just reminding this patient every week, and at last she said I got an appointment. So we don't want to leave them. That's because they are busy. We just continuously give them reminder. And honestly, Charles, you can only do it if you have a time. If you have so many patients to take care of them, you don't have time. You want to do it. You want to provide the same care of, but you cannot do it. It's humanly impossible to take care of so many patients and give the personalized care.
So as a doctor now, you're doing two different worlds. You've been in this world, now you're in this world. What's your quality of life just as a general, as a doctor? How has it helped you and your family just in general?
So, I mean, there's always pros and cons, right? But my quality of life is much better. Yes, I mean, we do get texts, we do get calls, we do get patients, but they're very respectful. But still, I'm home. After a certain time, I'm home. We do not have too much paperwork to do. Yes, if you have less patient, that you have less record to review. So there's always good point about it. But I feel like my quality of life is better. I've spent more time with my kids, with my family. I feel like this was best decision of our life.
So let's go back now. Like you mentioned, when you were in third grade, you remember wanting to be a doctor. Let's walk through like your whole process. Like where did you go to school, everything, if you don't mind.
So I studied, I was in Pakistan. So I was there until I completed my medical school. So I did 5 years of medical school there, and then I moved here. When I came here, I did 1 year of research at UD Southwestern. I got a chance to do research, so I did that. And then I got a residency in New York, 3 years, love it.
Wow, what part of New York?
I went to Lincoln Medical Bronx, which is affiliated with Cornell. So I did that, and then the moment I finished my medical residency, I started applying here because I want to come back. My family was here, and I got a job at Texas Health Presbyterian Hospital, Plano. But let me tell you, that was my dream to start working in Texas Health because I delivered my baby there. My first baby. At that time, I did not even know that I'm going to get a job there. So I was very excited when I got recruited for Texas Health.
Oh, that's so
And
cool.
I worked as a hospitalist for 5 years. Love it, enjoyed it, loved the ER, trauma, everything. But after 5 years, we decided to a little bit slow down. Our schedule was a little hectic. And then I went to traditional primary care physician. So I was I was always full-time. And it was like we did not have we started with 0 patients.
Wow.
And we built the practice. Wow. So Dina and I really worked hard for Texas Health Clinic. We thought it's our clinic. And it was our clinic. But it was the system was going, we were seeing so many patients every day. There was a lot of limitations, patient frustration. There was not enough satisfaction that we're getting. Now we are seeing, like, we always give the Press Ganey scores from our patients, and believe me, it's a huge
really big difference.
Oh my God.
That's cool.
Even if it's like slight difference in the points, we ask the patient, we don't know who's filling, but we really curious, okay, this is what happened, let's improve yourself.
Wow,
But it's an excellent score that we get.
Wow.
Because it's all about the time, it's all about your interaction with the patients, and we have excellent interaction.
Wow, and you're able, because of those interactions, they're able to feel at ease.
Their health is really good.
Wow.
Their health is really good.
You can track better.
Yes. We do have like 2 or 3 patients together, and how much I nag you.
It's awesome actually. Because it's funny because on the other spectrum, like for home health or hospice care, if you can't get a hold of a doctor, it's like you feel like you're not able to serve the patient better. But when you get a hold of a doctor, or you're texting me, it's like, I love you.
I get a few your staff calls, and I love it. I don't get annoyed, and this is sorry to bother. Okay, no, you're not bothering me.
It's awesome.
I really want to know what's going on. Please, can you do this? So I'm telling you, it's not about
and the collaboration. So like you were mentioning before, is like a lot of times when you call a doctor's office and you get the answering service, but the levels are off maybe, or the blood pressure is a little bit different, or you've seen some signs and symptoms. And then we're reaching out to another specialty doctor, but the specialty doctor didn't forward that information to the PCP, so the PCP is not even aware of what's going on.
Absolutely.
Then the patient themselves is like, what do I do? Let me go to the ER.
Yeah, exactly. And the best thing about our practice is, when you're gonna call, somebody will pick up the phone. They cannot put you on hold. That's how we are training. Even the physician pick up the phone. The phone should not ring.
That's cool.
Because that causes a lot of frustration.
Right.
So that should not be a phone tag. And patients are allowed to call us directly or call the front desk or my staff, but everyone has been trained to answer what patient is calling for.
Wow. Were there any roadblocks that when you went into becoming a concierge practice? Were there any roadblocks that you were like, whoa, I didn't realize this was happening? Or say for instance, another doctor who watches this podcast and they're like, I want to do a concierge. What were some things that you would advise them?
A lot of people, they approach us. When we, after a year, we went to some CME events and everything, and they were talking to us, and we said we loved it. Yes, they are struggling. Dina and I really learned, and we decided that we're going to do it on our own. We're not going to join any organization, company. We want to do it on our own. We learned. We did make mistake, but everyone make mistake and learn, but we did it. And we are open to help any physician who's interested in knowing, who's interested what we did. We are open to help other physicians as well.
That's cool. And that's the big thing is, I think, as a whole, the more doctors like you are able to serve patients, not rushing, not focusing on the patient themselves. I think the patient as a whole, they get better.
In the end, we have to realize it's not about the number of patients. It's a quality of patient. I mean, it's patient's health.
Yeah.
So I really think anyone, and I think everyone deserves personalized care. And everyone who wants to put their health as a top priority should go for concierge.
Yeah. Yeah.
Young, old, middle-aged, doesn't matter.
Wow. Oh, so that's a good point. So you see the whole spectrum. Is it 18
yes, 18
older?
and above,
older?
and we do have kids. We do have young kids.
Wow.
And when you start focusing the young kids with preventive and wellness,
it's a big deal.
It's a big deal.
Wow.
And it's so amazing when you see young kids. They are so motivated. They are like, we tell them, okay, don't rely on your parents, just call us if you need it. So they are calling from college. They are calling
good.
like they are, okay, this is what's going on. So it's really great.
Especially in college. I think that's a big deal, because then sometimes you go to a college and you don't get like
So
a
they-
local PCP.
Yes.
You just wait till summer and then they see, or even to come back
So
home.
so they call me from the college.
Wow.
Yeah, well, this is what's going on. What shall I do?
That's cool.
I love it, and they just want to be like some kids. They just want to be confidential, and I said yes, everything, and it is. I mean, I want to respect their privacy.
Wow, yeah.
And they call me directly now. Nothing like no concern, nothing.
Yeah, that's pretty neat. You never really hear college kids with a doctor that can just pick up the phone and call. You never hear that.
No,
You know?
I mean some parents, they really put their kids, and in our practice, if the kid is less than 26.
Yeah.
So it's not a big cost. It's
Yeah.
a very small cost they pay per year.
That's
so that's
cool.
why they want their kids to come under them. So that's a great advantage.
And it helps them make decisions. It helps everything.
It's
Proper
a great
decisions, good
yeah.
decisions. Because I know when I was 20-something, I probably didn't make as good decisions like I should.
Exactly. We were not even going to the doctor
no.
so regularly, right? So it's a really
Or the dentist.
Yeah. Yes.
Oh, wow.
Yes, you're
cool.
right. So it's a really good when we see the young kids are coming and coming forward, and they want to do all screening tests. We also keep some supplements, which is really good for their health, and they're very interested.
If you don't mind, talk about that. Different types.
So we do keep like supplements, because when we were like, honestly, I didn't know that they are. You have to take pure supplements. Even if you're taking vitamins, it needs to be pure, not with synthetic, which is available over the counter, the grocery, because your absorption is not so good. So we really research on the company that provide us the pure supplements, and we encourage patients to take those, which gonna give some benefits.
That's good.
So we have like supplements like multivitamin, probiotics, vitamin D, magnesium. We also have intramuscular,
nice,
intramuscular NAD, glutathione,
Nice.
Myers, which most of the people come and do. And Myers is basically a bunch of amino acids to help with boost your immunity when you're fatigued, hangover.
Yeah.
So these are the advantages that you can provide as a concierge. We also focus a lot on hormone. So we do all kind of hormone management. Dina and I now board certified obesity, so we focus a lot on the weight as well.
Wow, that's really neat. Are there any other, within that, is there any other things that you provide as a concierge doctor?
So we focus everything. If you come to our preventive and wellness, we have numerous screening tests available. And yes, these tests are not covered by insurance, but I tell my patients, do it one at a time. You don't have to do everything at once, but they are so good for cancer screening, because there are very few that we can screen. What can we screen? Breast, prostate, colon, uterine, right? But there are so many other cancers that you can miss.
In the blood.
Yeah. So now we have so many blood available that you can screen multiple cancer. You can do genetic testing.
Wow.
You can screen for heart. So I really think the advantage of doing all these screening is just become more proactive on your health.
Wow, that's pretty cool.
Yeah.
That's pretty cool. What were some things that when you look back, as a doctor that was not concierge, right, and you look back and you see the difference, what are some things that you would look back and say, okay, I wish I would have learned more or done more to kind of prepare myself, or is there anything like that you would have said? In general?
Like as compared to traditional practice?
Yeah. Is there anything you can think of?
I mean, I really think by looking at my 10 years, I don't think so that I wasted my 10 years. I still think that I learned a lot. But as compared to my traditional practice to concierge, I feel like I'm learning more.
Oh, that's cool.
Yes, I'm learning more.
How so? How so?
Because and the reason is because in traditional practice, we were more focusing on medical problems. Like, okay, patient has this. But I'm really enjoying doing
symptom management, not the root.
The root.
Wow.
And now, I mean, even then we used to figure out why the patient has this root, why the patient is having it. But now we really dig
into, and you have time to dig in.
Exactly.
And resources and dig in, and we have testing that we can do it. So it's really good how we are improving our knowledge as well. Wow.
So we are learning a lot.
Wow, that's a good point. I never thought of that until you said that, because now you're able to, there's freedom to some extent.
Absolutely.
Because you're able to see, okay, now let's focus on the patient.
And there are so many patients who really want to focus on their health. They really go for the screening test.
Yeah.
I mean, I really want to mention this thing because that was my eye-opening. My younger brother, no medical issues, and I just told him to get your screening for the heart because we have a family history.
Yeah.
He went to the cardiologist, did the stress test and echo, and it came back good. And he said, "Oh, listen, I mean, you all the time to give me lecture, everything came back."
Yeah.
And my heart said, "There's something wrong."
Something wrong. Wow.
Because he was a little short of breath. But he said, "No, I'm just overweight." Okay, what do you want me to do? And I said, why don't you do the Clearly CT, which is a heart scan. It's a CAT scan contrast CT of the heart. And he went and he did a Clearly CT, and he found 2 block artery, 95%. 95%. So he went for cardiac cath, and yes, there were 2 arteries. 95%. He got a stent placed, younger than me. So if he wouldn't go for the screening test, he would have symptomatic in few months.
Are you kidding me?
No, because some patients, they feel like their symptom is the normal symptom.
Yeah.
So you really have to dig in. You really have to spend time with them. So my brother is not my patient, but I just noticed that something's not right about it.
Yes.
And he was like, I mean, it was really eye-opening for him too. And since then, he's really taking care of himself. But it's just like that test really saved him.
Now he's like, I'm always going to listen to my sister.
I hope so.
Every time. Wow.
Yes.
That's amazing.
Exactly. So it's some testing I really feel like it's a worth.
It's important.
I mean, that saved his life.
Wow. Yeah. And those things, I think, because also, I mean, even though you said it was your brother, but the fact that you were aware of those type of testings because you had the time.
Absolutely.
Because you're able to inform that patient to make the right decision.
I mean, I'm not like in favor of doing unnecessary testing just to open the things which is not there. But few things really, like you're very necessary. Wow. I mean, and I think heart screening, cancer screening is one of the important screening tests that we should do it.
Wow. So when it comes to concierge, specifically, do you go sometimes and see patients in their homes, or is it mostly, do they come here to you, or what are some?
So we don't do the home visits. We don't do the home visits, and usually the patient comes to our practice. But if they cannot come, then we usually do the televisit, or we can also talk telephone encounters. Just to check on them and everything. So yeah, we don't do the home visits.
Okay, wow. Is there a radius in terms of how, and as long as they can come to where you are, that's cool. Wow.
So mostly like my clinic, our clinic is in Frisco, so Plano, Allen, McKinney, Prosper. So as I said, that I don't think so distance should be a matter, because even if you come once a year, but if you can do televisit, definitely when you see the patient in person, that make a huge difference rather than discussing your symptom on the phone.
Yeah.
So, but sometimes patients, they cannot come, but it doesn't mean that we cannot take care of them.
That's good. That's good. So how do people reach you if they want to become you become their doctor? How do they reach you? What's a good way to reach you?
They get my cell phone number.
Okay, cool.
So we have a cell phone number which is available.
Wow.
But I just explained to them that they are happy to call me for anything, but if life-threatening symptoms, then they might have to call 911 because sometimes, it's nothing. But we're usually very good in responding to the patient, but sometimes we are with the patient, sometimes we are busy during clinic hours. So I always train them, or if they need to be seen, they can just call my office as well. So we have given a lot of resources that they can contact us, and they don't have any issue with that.
That's good. That's good. Well, as we come to a close, what are some last things you would like to say about just concierge medicine?
I feel like I think the concierge medicine is a great way of practicing and providing the patient care. It's a personalized care, and everyone deserves it. Especially those who want their health to be first priority. And I think we need to focus on our health. We need to start investing. We do investments, so many investment, education investment, retirement. I think we need to focus on the health. Because if you have a health, you have everything.
You only have one body.
Exactly. And I really feel that our practice, which is Signature Internal Medicine, is a very strong practice. We are 2 female physicians. Me and myself and Dr. Dina Deal, we are strong. We are very passionate. We have a great work ethic, and our clinic atmosphere is so calm and friendly. And we welcome.
It's a really nice clinic. By the way, I love it.
You like it? Okay.
It's really sweet.
So we welcome everyone. We offer complimentary meeting as well. They are happy to contact, and there's no obligation to sign up. So please consider concierge medicine. It's the best way to practice and best way to get your health.
That's awesome. Well, Dr. Ahmed, I appreciate you coming on. This was great.
Thank you so much, Charles.
This is fun. We have to do it again. We do more.
Yes, awesome. We'll do it more.
Okay, good. Awesome. We'll see you guys.
Bye.
Thanks for watching this episode of Charlin Care Pods with Dr. Humera Ahmed. You can find Dr. Humera Ahmed at www.signatureinternalmedicine.com. Dr. Humera Ahmed and Dr. Dina Deal practice out of Frisco, Texas. Thanks again. See you next time.